So we're now going to move on to our novel hybrid format, and if all goes well technologically, we have Jason Bacha, who will be joining us, I believe, from Tanzania. Excellent. So we do have Jason.
Bacha, and this is the fast and the continuous. Dolutegravir-based antiretroviral therapy achieves impressive viral load suppression in children and adolescents living with HIV in the short and long term. I have no conflicts of interest to declare for this study. Now, the main objective of this study and analysis was to look at this cohort of children and adolescents using dolutegravir to see if viral load suppression rates were consistent and sustained over time. Spoiler alert, the good news is that we found very good results with very good suppression. This slide is showing the methodology for the study, reviewing the sites and countries included, the time period, the definition of viral load suppression, which was viral load under 1,000 copies, and a little bit about the analysis used with the 6-month post-DTG viral load suppression used as a comparator. There were 11,799 children and adolescents living with HIV included in our cohort who received DTG during the study period. This slide gives a quick snapshot of some of the clinical characteristics of this cohort, including their prior ART history, the DTG regimen they used, the breakdown by country, sex, and age. Overall, there were 21,077 person-years of follow-up with the mean follow-up time post-DTG of nearly 2 years. We had 22,577 documented viral load results ranging from 6 months up to 60 months post-DTG use. And the overall 6-month post-DTG viral load suppression rate for the cohort was 92.4%. And as you can see at the figure at the bottom, we had very good engagement in care with 93.7% of patients remaining active in care throughout the study period. And here we see the viral load suppression rates graphed over time for the entire cohort of our children and adolescents. The good news is that the viral load suppression rates remain consistent with no significant change and no significant loss. Of course, the table at the bottom shows the numerator and denominator over time, which does decrease as there were fewer and fewer children and adolescents on DTG for more than 2 or 3 years. We then wanted to look at some specific subgroup and disaggregated data analysis. So over the next few slides, we'll show that. And again, the good news is that the viral load suppression rates were maintained with no significant loss. This slide shows the female cohort. And this slide shows the graph of the male cohort. Here we've plotted the viral load suppression rates of the 4 age groups within our cohort. And this is a little cleaner presentation of the same figure where we've removed the 0 to 5 and 5 to 9 because they were quite small in number and more variable, but again, showing good sustained viral load suppression in our young and older adolescent groups. And finally, we plotted the same viral load suppression rates by country and by site. And again, we had no loss of viral load suppression over time, though there was a bit of heterogeneity and some slightly differences amongst the different sites, but sustained viral load suppression within each site. Finally, in this somewhat busy slide, there's a table that shows the difference in viral load suppression for each row, with each row being one of those sub-cohorts. And we were looking for any statistically significant increase or decrease. Again, for the vast majority of our patients compared to their 6-month post-DTG viral load suppression rate, there was not any significant change. Highlighted in red, though, we did notice a statistically significant small drop in the 10 to 14-year-old age cohort group at the 24 to 30 month. When we looked at the other 24 and 30 month, we noticed it was trending down And when we looked deeper at the data, we realized that this 2.5 year post-DTG did reflect some of the peak COVID-19 pandemic time for the majority of sites and patients, and could reflect some of the challenges seen with accessing care, travel, and supply chain difficulties during that time period. But definitely an area of interest we want to keep an eye on. Therefore, in summary, within our large cohort of children and adolescents, we found that dolutegravir rapidly achieved and consistently maintained viral load suppression for years among the cohort in real-world settings in East and Southern Africa. We do realize that the female and young adolescents remain key populations of interest for focused and continued scaled-up efforts to achieve viral load suppression. We also want to raise awareness that perhaps this 2 to 3 year post-DTG period may be a time of particular interest. However, again, realizing the COVID-19 pandemic did affect this period. We have a pretty robust data set, so some of our next steps include deeper, more thorough additional analysis and sub-analysis into our cohorts and sub-cohorts, looking for more potential drivers of high and low viral load suppression rates, and of course trying to extract some data and information about psychosocial factors and adherence factors driving some of the findings. But we were optimistic with our findings that viral load suppression was maintained and not lost over time with DTG, and we think this does add further support for widespread use of DTG in children and adolescents, especially with the 10 milligram dispersible being rolled out currently and in the coming years. And on behalf of the study team and everyone across the Baylor National Network, I'd like to thank you for your attention, and here is contact information if any questions about the study or data within. Thank you so much.